subscribing and writing me your comments below. I'm so happy to see you guys text to each other, chat with each other, share your experiences. Thank you for being here. Thank you for liking, sharing, and subscribing. I appreciate all of you. Thank you, thank you, thank you. We're talking about a COVID questionnaire. This is I'm gonna call a screening questionnaire, and this is section 2. If you haven't watched, you should click on this box above and you should find a section 1, which is called COVID vaccine consent form. And then this is gonna be a video about screening questions for COVID. So let's start. We are ready. So some of the pharmacists or the doctors ask additional questions. So I'm going to start the form the way it. They ask you, what is your sex, female or male? This is in the form and you should be able to interpret that. Then they ask about your race. A lot of people doesn't know, or ethnicity. If they ask ethnicity, people get confused. If they ask race, people get confused. And here is American Indian or Alaska Native Hawaiian or other Asian, and no Asian Pacific Islander, non-white, Black or African American, white, other Pacific Islander, Hispanic or Latino, not Hispanic or Latino, unknown. And there is other white, other background, or white European in some forms, depends. But some of them ask about their backgrounds, okay? The section 2 is called screening questionnaire, and this is yes or no for each question. This part that I'm gonna read right now is included in most of the, in all of the, like, it's health questionnaire and they include it before they give the vaccine. So I just cut it in 3 parts because it's gonna be 2 long videos and I want to keep it short. So we're talking about the screening questionnaires. They're about 12, and then the consent form, which is slightly different than the previous one. Do you have today, or have you had any time in the past 10 days, fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or running nose, nausea, vomiting, or diarrhea? All these symptoms, you gotta know them pretty well in order to do it, but they give you time. You have time if you don't know some of them. Have you tested positive or have been diagnosed with COVID-19 infection in the last 10 days? Yes or no? Have you had severe allergic reaction? Okay, so for example, they give you, for example, epinephrine or hospital care to the previous dose to the vaccine of any ingredients of this vaccine. Have you had any other vaccination in the last 14 days? Influenza vaccine, flu shot, TB shot, anything like that? Have you had any COVID antibody therapy within the last 90 days? Example, Regeneron, Bam, Lam, V. Okay, I'm gonna try again. The first treatment is called Regeneron, Bam, Lan, Ni, Vimab, COVID convalescent plasma. Plasma is transfusion of blood, and so on. The second part is called immunization screening guidance for COVID vaccine. So I just want to clarify something about the previous question. The treatments, the doctors doesn't read normally all these complicated things. They just say, have you had any antibody therapy for COVID in the last 90 days, which is normally where the questions stop. This is additional. In some form there is, but if it's over the phone, you cannot, they don't read it to you. So just that. Immunization, screening, and vaccine. Please check yes or no for each question. Normally, if you're in person, you just read the meaning, which is called transcribing. When you have the form, you can read it, but you cannot write. The patient have to write themselves. So, do you carry an EpiPen for emergency treatment of anaphylaxis and or have allergy reactions to medicine, food, vaccine, or latex? For women, are you pregnant or is there any chance you could become pregnant or be pregnant right now? So the vaccine is dangerous for people that are pregnant. For women that are pregnant or have a little baby, are you currently breastfeeding? Are you immunocompromised or on a medication that affects your immune system? Do you have a bleeding disorder or are you on a blood thinning medicine? Have you received a previous dose of any COVID vaccine? And if yes, which manufacturer and vaccine did you receive? And normally the patient know what they have received. And then the last part, which is they ask the people to initial this part. In each form it's organized differently, but the information is similar. I understand that it's not possible to predict all possible side effects or complication associated with receiving the vaccine and the vaccine or vaccine's name. I understand the risk and the benefit associated with the above vaccine and I have received it, read and have explained it to me. The emergency use authorization, which means that I am aware and informed about all the risk and emergency cases. So, and I have received the fact sheet on the COVID-19 vaccine. I have elected to receive, which means that they have received the form and they know all the emergency risk of it. I also acknowledge that I have had the chance to ask a question and that such questions were answered to my satisfaction. I acknowledge that I have been advised to remain near the vaccination location for 15 minutes or more in a specific cases after the administration for observation. If I experience a severe reaction, I will call 911 and go to the nearest hospital. And this is where this consent form stops for me, but not for the doctors. That's video number 2 about the consent form, and I will get now a registration form for COVID in the next video, so stay tuned. We're talking about the COVID. Also, thank you for liking, sharing, and subscribing. Thank you for being my guest. I appreciate you and I hope you have a good day. Bye-bye.